Okay, I have 10 o'clock. I have hit record on the meeting. Welcome to the April 1st Sacramento County Public Health Media Briefing. Just a reminder that to have your Zoom on mute until the end when we ask questions. I am going to hand it over to Dr. Casserier to provide a short update, and then we'll hear from two other public health staff members, and then we'll open it up to question and answers. Dr. K.
Good morning, everyone, and thank you for joining us. Dr. Olivia Casserier, Public Health Officer. So by the numbers, Sacramento County now has 97,617 cases of COVID-19 reported to us and 1,603 deaths. According to the state blueprint, we are at 7.4 per 100,000 cases. That's over a 7-day average, and our positivity is at 2.9%. So we are still in the red tier. In order to get to the orange tier, we would have to have our case rate drop below 4%. 4 per 100,000. So what we have seen lately in the last week is that there's been a little bit of an uptick in our cases. And many of these have been related to youth sports. And our school team is working with the schools and the coaches when cases are reported and identified, and we make sure that the rest of the team is quarantined. The outbreaks have been very small. So, and once we have the team on quarantine, we're able to stop the spread of the infections. We do not have a lot of concern about its a larger uptick, because right now, especially because with the vaccination, we started off with vaccinating the long-term care facilities, where in previous surges, we had large outbreaks. But this time around, because of the vaccination, we feel that there's much better control. But definitely there is some concern because of the uptick, so we continue to monitor that. I do want to point out this weekend we have Easter Sunday. A lot of people do attend church on Easter Sunday, and many of the churches are planning to have in-person services. We ask that everyone remember to follow the protocols, make sure that if you're sick, however slight or mild the symptoms are, please stay home. And if you do go out in public, please remember to use the face covering, stay 6 feet away from others that are not from your household, and avoid gatherings. With that, I'm going to turn it over to Rachel Allen to give us an update on immunizations.
Hi, good morning. I'm going to update you on our allocation for this week and also the expanded eligibility guidelines. So we received our allocation last night, and Sacramento County will receive 33,000 doses of COVID vaccine for our provider network. That's 11,700 doses of Pfizer, 9,200 doses of Moderna, and 12,100 doses of Johnson & Johnson. So big increase in the J&J this week. And it looks like the projection is that will be fairly flat, but similar over the next few weeks. This is the first week that we're working jointly with Blue Shield to make the allocation. So we've been helping them through this process to learn who our providers are. And this week they're actually allocating to the providers that they have contracted in the network, and then public health will allocate to the remaining providers. So they have about 1/3 and we have about 2/3 of the providers. Next week, we'll continue to do a similar allocation where they do part of it and we do part of it. And then my understanding is the following week, Blue Shield will be making the allocation independently. And so there is expanded eligibility, as I'm sure you know today. We're moving to anyone 50 and over is eligible to be vaccinated. And so I know there's going to be a lot of questions about where can people be vaccinated and do we have increased capacities. So a good point of reference is the county website. We do try to keep it as up to date as possible. And it includes pharmacies and links to providers. And it also has the stationary pods, but also pop-up clinics are on there. So I think encouraging folks to check that pretty regularly to see what sites are available for vaccine. And then April 15th, we're going to be opening per state guidance to anyone 16 and over. And so we can talk more about that next week, but we did want to make an additional note to remind people that only Pfizer vaccine is approved for children ages 16 and 17. We do see already some kids registering at sites that have Moderna or Johnson & Johnson, and they're not eligible to receive the vaccine at those sites. So just a heads up, I think, to the community and to providers and parents that their kids need to go to a Pfizer site once they're eligible. And then I did want to just make a quick update about Cal Expo, because we had let you know that we were transitioning out as the provider there and bringing in a contractor to run that site. It's Curative, the same contractor who's running the McClellan site. And as we were looking to that transition, we had just started doing second doses, kind of trying to finish up our work there so that they could come in. But with the increased eligibility, or the opening of eligibility and increased doses of Johnson & Johnson, we are going to be doing some first dose Johnson & Johnson clinics, which of course is the first and final dose because it's a 1-dose series. Those will start tomorrow. And we're also using it as a training opportunity for our staff and partners to come in and work with that vaccine, since very limited partners have handled it thus far. So there will be appointments for Johnson & Johnson doses over the next few weeks as we're transitioning out. And I'm going to turn it over to Stacy Kennedy.
Good morning. So as we expand eligibility, we are still going to prioritize our hard to reach and underserved populations. We've been working with 211 to reserve some appointment slots for people that have no computer or internet access or have significant language barriers. They can call our 211 phone line, and 211 will help them make an appointment. We're also going to continue to prioritize certain populations, such as agricultural workers, people experiencing homelessness, set up special vaccine clinics for them where needed, and our disproportionately impacted communities as well. We'll have special pop-up events for those communities. So I think that's all I have.
Okay, then we will go ahead and open up questions to the media. As a reminder, please stay on mute until it is your turn to ask a question. Because of the volume of people we have in here, I request that you use the hand raise feature, and I will call on you. Please identify your name and outlet before you ask your question, and our panel will go ahead and answer the question for whoever is best suited to. So who has any follow-up questions? Okay, Chris Hooks, go ahead.
Chris Hooks with Cap Radio News. Over the past couple of days, we've had a few other county health officials voice some concern about not having enough vaccines, not having enough doses as the vaccination eligibility expands. Is there any concern with that here in Sacramento County?
I can go ahead and take that. I think it's going to continue to be a bit challenging until we see a good increase in doses. So this is encouraging to have a week where we have more vaccine, but it's certainly not, sorry about that. It's certainly not enough doses to cover the increased number of people who are entering the eligibility phase now. So, we're going to continue to get doses out as quickly as we can. And providers know that when they get doses, the expectation is that they are out within 7 days. So we're going to continue to push doses out and hope to get more vaccine as these vaccine companies are ramping up production.
Okay, then I have Michael from Sacramento Bee.
Hi, this is Mike McGough, SecB. So at this point now, I understand that Sac County has a couple 100,000 residents that would be fully vaccinated. Does the county have any data about how many infections, if any, there have been in that group? Because I know the clinical trials show Pfizer and Moderna vaccines being about 95% effective. So I was just wondering if Sac County has any real world numbers about how closely its rates are coming. Thanks.
Jamie, do you want to take that one?
Sure. So my name is Jamie. I'm the incident commander for the COVID response. I can circle back with our epidemiology team and get back to you with a specific answer for that question. I don't know any off the top of my head, but we can pull the data from our data system to see if there's been any partially or fully vaccinated people who have acquired COVID. Unless Dr. K, if you had additional information.
No, that's it.
Okay, Monica from ABC 10.
My question is, how is the county working to increase the availability of vaccination appointments? And what advice does the county have for people who are finding it difficult to get an appointment? Any resources or advice for them other than going on the site and seeing where they can go get vaccinated?
So I can start, and then I'll have some of the other staff jump in as well. So I think one important thing that we've tried to do is put out a message to make sure that people are aware that we still have a limited number of doses, so they have to be patient while we work through the lists. And if they are not able to get through the first time, is that they should continue checking our website. The reason that we are promoting our website is that we're getting links from all of our other providers and putting them in one place. So that's one place that people can go and check and see if there are any appointments available. And then for those, as Stacy mentioned, where they have either barriers with getting access to computers or internet, or have language barriers, or have some difficulty with maneuvering through the different systems, is that they can call 211 and get assistance with being able to get appointments. And as we mentioned, also, we are setting up additional pop-up clinics and working with community-based agencies to especially do targeted outreach to underserved communities that have been hard hit by COVID-19, and making sure that we provide access so that they can get to some of these clinics.
If none of the other public health staff have anything to add on that, I will move on to Doug Johnson from Fox 40.
Hey, Doug Johnson with Fox 40 News. I'm just curious, what's being done to ensure that the people that are getting vaccinated in Sacramento County actually live in Sacramento County or actually work in Sacramento County? I mean, are there fail-safes to make sure people aren't coming elsewhere to get a vaccination?
Hannah, did you want to answer that one?
Hi, good morning, everyone. My name is Hannah Albright, Sacramento County Public Health. All of our systems do ask for the occupation, and when people make their appointment, they're asked to bring their work ID to the site, and then that's looked at the site as well. Obviously, it's very difficult to check every single person's address and work information, but we have added that onto the questionnaires. Rachel, anything you want to add?
No, I think that covers it.
Okay, Alex from Sacramento Bee.
Hey, Alex from the Sac Bee. I have sort of two questions. The first one is, can we get a status update on opening of a mass vaccination site in South Sacramento? And then my second question is, there's a lot of talk sort of nationwide about the potential for a fourth wave. I know there's been sort of conflicting insights from different epidemiologists in California. I'm wondering what locally you guys are seeing on the ground and what you're worried about, if at all.
Hi, Alex. To answer your first question about the South Sacramento before I pass it on to my colleague to answer the second. With the South Sacramento, we are still working on the logistics to finalize and select the location for the large output site. But in the meantime, we have partnered with a lot of community-based organizations. For example, La Familia, the Pinal Center, and others to kind of work with community partners to make sure South Sacramento community members get access to vaccines. So with that said, I'm going to pass it to my colleague to answer the other one.
So about the fourth wave, definitely we have heard the warning from the CDC about the possibility of fourth wave. And so we do have some concern, especially because we know that there are some of increases in some of the states, and some of the states have also lifted all of their restrictions. So, and then we also know that people are traveling. So we have people traveling into California from those states, and people from California going to those states. So for those reasons, there is some concern, especially also because we know that there are variants that are circulating. But I think what we have tried to do in Sacramento and in California is to be phase the lifting of restrictions and be careful with that and still following the data. So that's why we still have the tier structure in place for reopening. And also that we still actually have a travel advisory in California. And then we're trying to vaccinate people as quickly as possible because I feel that that's the best way that we have to be able to get past this.
We have another question from Monica.
My question is, will the county be able to handle everyone 16 and older being eligible to get the vaccine in a couple of weeks, since we are already seeing a backlog of people trying to get vaccinated with this new eligibility of 50 plus?
I think it's just going to add to the number of people who are trying to get appointments. And so that is why we hope that we will see an increase in our vaccine allocation, especially if Pfizer is the only one that will be available for those 16 and 17. We're hoping that we'll have enough of that to be able to meet the demand, but it will depend on the allocations that we get.
But as of right now, do we?
As of right now, we do not. We do not have enough for the demand that we have right now. So that is why we are asking that everyone be patient and keep checking the website as we put up additional appointments.
Another question from Chris Hooks.
Sort of along the lines of the vaccination and whether or not we have enough. Is there any concern with Blue Shield taking over completely in the next few weeks that, one, we will have enough to address the expanded vaccinations for 16 and older, and then two, are there any concerns about whether or not that'll change things the way the county deals and works with some of the more local and community partners to get more equitable vaccines into people in lower income communities and harder to reach communities?
I think any transition is difficult, especially when you're in the middle of a pandemic. We've been accustomed to doing the allocations one way, and now we have to adjust. But I think what we're trying to make sure of here in Sacramento is as much as possible to work with the Blue Shield contact and work through the issues that are coming up to make sure that they do not disrupt the allocations, and also make sure that we are in communication with all of our vaccine providers to make sure that they get the allocation that they need, and make sure that we have the clinics available to use up all of our vaccine each and every week.
Monica, did you have another question?
Yes, I wanted to shift gears to Easter weekend. Does the vaccination status of people affect the county's recommendation for gathering over Easter?
At this point, it does not. We are still using the tier system. And one of the things that we are asking everyone for, especially those that are planning to celebrate, is as much as possible to have outdoor celebrations because those are safer. If they are going to meet with family, it should be 3 families max that gather together. And also, again, to follow all of the precautions in using face coverings, 6 feet separation, and stay home if you're sick.
Okay, Chelsea?
So the county has been receiving an increased supply of vaccines over the last 3 weeks, according to what's been said in these briefings. Is it hopeful that we'll keep seeing a similar increase each week?
I think the projection that they sent out with yesterday's allocation shows, and it is a projection, so there's a presumption that it will stay at least flat. So the same as this week for the next 2 weeks, but I think there's always the hope that there will be more. We don't have any certainty, and we still, we still only get the allocation 1 week at a time, the actual numbers.
Okay, I do not currently see any more hands raised. Do we have any follow-up questions? Okay, then I will go ahead and close it out. Just a reminder that
Yeah,
the
it looks like
recording.
Alex
Oh.
with Rugby has a question.
Oh, Alex, go ahead. Alex. Sorry about that.
No, I apologize. I don't have the hand raise function, so I've been in the chat. I just wanted to follow up on that South Sac vaccination site because, to me, pop-ups are like a one-time deal, sometimes two-time deal. I guess I'm wondering what is currently the holdup for opening up a South Sacramento location? Is it finding a location? Is it finding figuring out who's going to be the distributor there? And do we have any sense of if it's going to come online in 2 weeks, in 3 weeks, next week? Yeah, any clarification there would be great.
Definitely. I guess there's many components and pieces in order to host a mass vaccination site. So because of those logistical factors and pieces, we're working hard to figure it out and get it up soon in terms of location. We have a few that we've been in contact with. So this is why we're trying to figure out the pieces to make sure not only it's equitable and inclusive, but also safe and in a trusted area that a lot of community members, especially South Sacramento community folks could access to. So I want to be mindful. I don't want to deliver any false promises or false hopes. So that's why we say, please stay tuned as we work and continue to get that out. As soon as we get more solidified information, we will make sure to share with the public. In terms of the community pop-up sites, some of them are on consistent basis, such as the Pinal Center. That is on a weekly basis where every Friday community members, we're leveraging the community-based organizations to do that targeted outreach. So folks could reach out. And in addition to that, other community-based organizations are doing it on a consistent with our health system partners.
I have a follow-up question from Chris Hooks.
Yeah, just to follow up on Alex's question, just is the expectation that the third site would still be in 95823 zip code specifically, or have you guys expanded that?
That's the goal. We are utilizing, again, the quartile 1 of the Healthy Place Index to really outreach to these, looking at these zip codes of vulnerable areas where we could really ensure it's equitable and inclusive. So 95823 is one of the zip codes that we are still focusing on to do the South Sacramento pop-up site, and not pop-up site, the mass vaccination site.
Monica?
This just came to mind. Say we did get enough vaccine allocation and there was enough to meet demand. Would we even have the storage space to hold these excess vaccines? And is this allocation being due to us trying to make sure that we don't waste or spoil vaccines and make sure we have the space to hold them, if that makes sense?
I can address the storage. You can put a lot of vaccine in freezers. I mean, even with, we can put 100,000 doses in a unit and there would still be room. So I don't think storage will be an issue. We're onboarding new providers every week. They have to go through the state's application process. So the network is expanding of people that are going to be able to offer vaccines. So I think as the allocations increase and we have more providers and we have many providers asking for more doses than we've been able to give them. So I don't think it's going to be an issue, but storage certainly I don't see being an issue.
So we are on track to get more vaccines to meet the demand?
Just like I said earlier, we only get the numbers 1 week at a time. So.
Okay, I don't see any more hands raised. Nobody else in the chat. So just a reminder that I will send out this full meeting recording probably within the next hour. And we will host our next media briefing next Thursday at 10 a.m. Thank you, everybody.